Hello, dear colleagues. My name is Dr. Arash Zarinpour. I'm an orthodontist in Paris, France, and I'm very pleased to have this opportunity to introduce and present the Aligner orthodontics to you. As you well know, orthodontics is about fixing aesthetics or functional problems related to crowding, discrepancies, or jaw relationships. For decades, we have used different tools like braces, bands, plates, and this kind of unpleasant things to correct those disharmonies. But for some years now, we are using a new technique with plastic splints called aligners. I have been using aligners in my clinic for 20 years now and treated more than 4,000 patients with it. These aligners are custom-made for each patient and need some 3D calculations done by special softwares where we are able to simulate all the teeth movements that we want to achieve and then build a series of steps where each aligner that people wear for about 2 weeks will move the teeth for 0.2 millimeters or 1 or 2 degrees. For practitioners, it is obviously a great evolution because they don't need all those pliers and metal material anymore. All this hardware and iron smith is replaced by very thin and comfortable plastic splints. As a result, the manual knowledge and training is less necessary with this new technique, and that's why it is more affordable to all GPs. For patients, of course, this is a big change, especially for adults, but teen or adults don't need to look like Ugly Betty anymore. Now they can have a very discreet, quite invisible treatment, and no one will notice. Aligners are very comfortable, and they can wear them off for meals and for special moments. So, on everyday use and social relations, this is a huge evolution for them. The pressure is less too, so it's quite painless compared to braces. This is one of the reasons why there is such a huge demand for aligners in all populations around the world now. So how does it work? You have to send some records to the company producing your aligners, and everything can be done online. You just have to send patients' impressions, some photos, some radiographic X-rays, and fill up a prescription form on the dedicated website. The Smilers website will guide you through the process, and you will have to upload some patients' photos, and these are just 2 portraits. One front view with a nice wide smile and one profile on resting position. These photos are quite important now because a lot of simulations and superimposition will be done on them, so you should take some care about this and have your patient standing still and having the head not tilted, and for the profile looking far away. Then you will need some intraoral photos, of course, to give the best information to the orthodontist who will do your treatment plan. These are the 5 photos that you will need to upload to the website. You need the occlusion on a front view, right and left view, and the occlusion view on the upper and on the lower jaw. It is mandatory to use cheek retractors and mirrors to have the best quality possible. For the impressions, you have 2 options. You can use silicones to do a conventional physical impression, and for that we will ask you to do the wash technique to have the best quality and detailed impressions. You should understand that the quality of the impressions will influence the quality of the aligner adaptation and fitting, and then the quality of the treatment. After years of experimentations, we realized that the wash technique that is done in 2 steps, one first impression with the putty, and then the second one washing the first one with a light or super light silicone, is the best option we have with the less drawing or deformation on the impressions. If you do silicone impressions, you will have to send them to your lab or to Smiler's lab to have them scanned and transformed to STL 3D digital impressions. The other option is to do an optical or scan impression. Smilers and Biotech Dental have their own camera called WOW that you can try. There are quite a number of cameras now in the market, and WOW is the smaller one and one of the cheapest, doing very nice color impressions because it has a quite different technique. It doesn't have any hardware. It's just the software, and the WOW itself is just a video camera, much like the iPhone cam. And so you are recording a movie of the patient's jaw, and the movie transformed to a 3D impression with the artificial intelligence of the software. The resulting impressions are really high quality and fun images that you can use for a lot of things, of course, not only orthodontics, but for prosthetics, for patient communications, and so forth. So if you don't have a cam today, just ask for a try and see if you like it or not. There are numerous cameras on the market, and Smilers and Biotech Dental are accepting any STL files coming from any camera. So if you already have one, don't hesitate to send your impressions to Smilers to have a nice orthodontics aligner treatment done for you. When you're a member of Smilers, you have access to the dedicated website, and then you'll have your own personal page and you can add your patients. To add a new patient, when you have all your records, just click on Add New Patients here, and then you'll have some prescription form to fill up. It is a quite easy and classical orthodontic prescription, so you will just have to click on the selected choices for your patient treatment and eventually put a comment on special needs or demands that you have on the box below, and just keep on turning the pages and filling up. When you have finished this and send all your comments, then you will have to upload your photos. Here you have some boxes with the reference of the picture that you need to put on each box written down under. So you just have to click on the box and it will open your computer dedicated folder. And then you'll just have to choose the right photos. You can also do a drag and drop if you prefer. You see that we have all the photos that we talked about, and when all are uploaded and appear in the boxes, you can go to the next and last step where you will be sending your impressions. You can send digital impressions or you can send traditional silicone impressions, and for that you would have to ask for a carrier or send it by yourself to your lab or to Smilers. When everything is ready, you just have to accept the terms of selling and click on Send. You will have a new patient number and folder created on your website. Then they will have to work at Smilers and prepare everything. We will talk about all these in the next videos, where here we're doing just an introduction, but of course, don't worry, we will go over every step again with much more details and explanations. For now, we are doing just an overall review on what the aligners are and how it is working with Smilers. When they finish to prepare your treatment plan and simulations, They will send them back to you, and you will have on the patient page something like this, where you can see the treatment plans. So if you ask for one treatment plan, you'll just have one treatment plan. If you ask for two, like here, you will have treatment plan number 1 and treatment plan number 2. You will have to check the plans, and if needed, ask for modifications. You have different options offered. You have a PDF paper file giving a resume of the treatment plan. But the best way is to click on See Smiler Story. The Smiler Story is the 3D video software that will show you all the movements and the attachments and stripping and all the timeline for your patients. So when you click on See Smiler Story, it will open a web app to look at your patient's teeth movements, and you can also share the Smiler Story to send a link to your patients or colleagues to check the treatment plan on a computer, a phone, on an iPad. When you click, it will open a window that looks like this, and you'll have to push on the play button to see the movements going on. You have a lot of options, of course, that I will talk about in later videos. You have the timeline and a lot of tools. In this little web app, it's very convenient, but mainly it is done for this, checking all the movements and the steps. We can see for these patients here that we have 15 upper and 16 lower steps or aligners that you can check on different views, of course, from every angle. If you're satisfied, you will validate the treatment plan, and if you need some change or some explanation, you have a chat box on the patient page when you can ask questions to the dedicated orthodontist that did this treatment plan and simulation. Okay, so when you're happy with the treatment plan and you want to validate, you will check on the right button to select the right treatment plan, and then you will go and confirm and validate. Then they will start the production of aligners for you at the company. Everything will be prepared in Salon de Provence, south of France. They will build all the 3D STL models and all the aligners that they will send you in a nice box where you will find all the patient's aligners stored on blisters. On each blister, you will have the step number out of total aligners for upper and lower jaw. Patients will have to open a new blister every 15 days and change their aligners. As you can see, aligners are quite easy to handle for patients. And when they are correctly worn and the fitting is perfect, they are quite invisible. During the treatment course and checkup appointments, chairside activity is very little. You and your team will just have to check the correct wearing and fitting, hygiene, and the presence of attachments mainly. And then, a few months later, you will have the great pleasure of seeing very nice results on your patients for a wide range of different indications, giving them wonderful new smiles and, as a matter of fact, new lives. Aligners can be used to treat simple to complex crowding, open bites, overjets, overbites, space management like diastemas or implants preparations, occlusal problems, TMDs, and surgical cases. The more complex the case is, the more number of aligners it will need. And we sometimes need to associate some orthodontic accessories for some cases. Accessories like elastics, buttons and chains, mini screws, etc. That is why having a training is necessary. to use aligners correctly. Especially if you're not doing orthodontics yet, you will need a course on the mechanics and protocols, and limit yourself to easier cases first. Then go to mild cases, and eventually, when you have a bit of experience with it and the adapted training, start treating complex cases. We will, of course, teach you how to separate easy and mild cases from the severe ones, and how to select the right patient at the beginning. If you are already an expert and using aligners, you will enjoy right away all the great possibilities that Smilers can offer. Well, this is it. I hope you enjoyed this introduction, and I will have the pleasure of talking to you again on the next episode. Have a nice day.